Hello everyone, myself Dr. Vivek Pandya. Welcome to our channel and keep learning with me. So today's my new topic is secondary amenorrhea or the delayed periods, or you can say irregular periods. So secondary amenorrhea or the irregular periods are very common in young female age group, and the parents always get distressed about the period problems. So normally a patient goes to the gynecologist and the gynecologist recommends step-by-step tests for the patients. Test prescribed for one patient, maybe the other patient does not have the same prescription of the test. So you should not worry about that because it varies from patient to patient. So first of all, following tests are done initially when the patient with the secondary amenorrhea comes. First is pregnancy test and the second is thyroid profile test. So pregnancy test, if pregnancy is suspected, normally gynecologist recommends it. If it is negative, then the thyroid profile test is the second test of choice. If the thyroid profile test comes positive, then the obviously thyroid treatment is given to the patient. If thyroid profile test is also negative, then the blood prolactin level is checked. In the prolactin test, if the prolactin level is significantly increased, which is called as hyperprolactinemia in the medical term, then the MRI of the brain. So if MRI brain is showing these three differential diagnoses, first of all is pituitary adenoma, second is craniopharyngioma, and the third is meningioma, then the obviously surgical treatment is done for that causes. If the MRI brain is normal, then the bromocriptine is the treatment of choice. If the prolactin test is also negative or the normal levels are there, then normally doctor goes for the progestin challenge test. If progestin challenge test is showing period bleeding, then obviously anovulatory cycles are suspected. The differential of anovulatory cycles are the PCOD, which is the most common. The second most common is adrenal hyperplasia, then the Cushing syndrome, and the last one is ovarian tumor. So this can be the differential if the bleeding is present. Even if progestin challenge test does not show any menstrual bleeding, then a gynecologist normally goes for the estrogen plus progestin challenge test. So after the test, if the menstrual bleeding is there, then the doctor normally recommends to do FSH and LH test. So if they are significantly increased, then it might be due to the premature ovarian failure. So if FSH and LH level are normal or within the normal limits, then again the MRI of the brain is done for the pituitary adenoma, craniopharyngioma, or the meningioma. If bleeding is not yet there after this all tests, then that might be the history of Asherman syndrome due to previous abortions or the inflammation of the endometrium, that is called endometritis. And if the MRI of the brain is also normal, then the hypothalamic cause is suspected. So hypothalamus controls most of the hormone system of our body as it is the boss. So hypothalamic cause is suspected if all tests are coming negative. So this was the very brief information about the test and how the different patient has different tests recommended by the doctor. So don't get confused, trust your doctor and go for the tests. Thank you so much. Hope you have liked this video. Please like, share and subscribe my channel for such more informative videos.